discussion. That's the discussion that is nice. And I'm waiting all to be in this live vlog that's about the title as shown. So I would like you people to join me today, and those who have joined to share. I'm happy we are going to move on well. We are going to move on here, and I'm praying that not laying its head today. And telecom, good, but there's buffering of internet. So basically, the topic of today is management of male infertility, and also we look at its causes. And I'm very happy that this type of discussion will involve very many people. And I think those who have joined, thank you so much. Welcome to PAMLIVLOGS. And we are having a discussion today, of causes and management of male infertility. And in this particular scenario, we are going to tackle this bit by bit until we will clear the discussion. And I'm hoping that you guys are going to be with me until the end of this discussion. And if you have joined, please continue saying that you share the link to people so that they be in the discussion and we move on well. Yeah, thank you so much, Leah Imba, for joining, and welcome to PAMLIVLOGS. Every to join this discussion. So earlier on, I discussed about causes of female infertility, and it was a very nice topic and a nice discussion. And I'm very grateful for those who have been watching my videos and been sharing in terms of the medical videos that I normally make. And this discussion, we are just going to tackle majorly the causes, and we'll move to a bit of the management of infertility. In this context, management of infertility in male. Last time I did of female, and I'm very sure that for those who have been watching my video, you have been seeing how we've been moving in terms of causes of infertility. And of course, also I'm promising you that we will also do the management of infertility in females that I'm about to tackle in some videos that I will make. So welcome again for those who have joined, and feel free to post any question that might be in your mind in terms of the discussion of today, and I would like to answer them when we are discussing or when we are about to end the discussion. Now, definition of infertility in male is inability to cause pregnancy in a fertile female. If a man is not able to impregnate a lady over a period of time, particularly when doing sex, regular sex within a period of mostly 1 year with no conceiving, then we start thinking of infertility. And in this scenario, we say that both male and female should not be blamed of this scenario of infertility. Now, under causes of infertility, we are going to tackle it into three parts. And first part is abnormal sperm production. And second part is problem with delivery of sperms. And lastly, in the courses, we are going to discuss environmental factors that surrounds the causes of infertility in male. Now, first of all, one of the causes and abnormal sperm production, I do not want to go deeply into how spermatogenesis takes place, that is about how sperms is being manufactured, rather than I'm going to concentrate on what likely can cause infertility in a man. And as you can see, one of them, the causes is what we call cryptochildism, which is undescended testes. You will find that when you are doing an examination, particularly a male children, with testes, some are presenting with testes that are either small or one-sided. So if you have a condition, genetical factors that surround this particular issue, and one of them is a condition called Klinefelter syndrome. Klinefelter syndrome is a genetical disorder whereby there's an extra chromosomes which is added in this particular people who have this condition. A normal person has a normal person should have a pair of 23, that is 46 chromosomes, but in this scenario, there is additional X chromosomes, and those who normally have this, they present with small testes, reduced sperm production, and this additional X chromosomes normally causes reduced testosterone levels and sperm production in this particular individual. Another genetical disorder is what we call Y chromosome deletion. When Y chromosome is deleted, the deletion normally affects the protein production during spermatogenesis, and this one can result into infertility in men. And there's also a condition called an inherited condition called cystic fibrosis that can also cause infertility. Again, we have medical conditions that are very, very clear in the causes of infertility. Diabetes mellitus mostly cut across, and in this scenario, we have it as a cause of infertility. Increased sugar levels in human being normally interfere with sperm production. And also we have diseases, majorly sexually transmitted diseases, and this can interfere with the transport of sperms, and also even interfere with sperm production, particularly when there's a age may be caused by untreated gonorrhea or untreated syphilis or mumps. Those are diseases that can result into causes of infertility. In fact, they can even attack the prostate gland, even the scrotum. If they attack a prostate gland, we have prostatitis, and even the inflammation of the testes, that is otitis. When in this scenario of abnormal sperm production, we have a condition called varicocele, and this varicocele is enlargement of veins in the scrotum. When there's enlargement of veins in the scrotum, this normally increases temperature, and this one can even denature the functions of the sperms into the testes. So it's another major cause of infertility in men. And mostly people normally come to the facility when they say that I'm seeing abnormal dilatation of veins into in my scrotum, and then if we ask further, we find that this particular person has a history of infertility. And of course, this one we'll also discuss during management. Again, we have what we call erectile dysfunction. And kindly, if you have been watching my videos, I talked about amazing fruits that normally help in erectile dysfunction, and also I've also talked about one drug called sildenafil citrate in terms of management of erectile dysfunction. So this one can be is also a major cause of infertility in now we have problems, and one of these is premature ejaculation can also result in a low sperm count that may genetical disorders that I talked about. We have what we call cystic fibrosis that I've discussed. Thank you so much for those who have arrived. I kindly seeing a Code TV, kindly share the link to the group so that we continue with the topic. Now, we have structural problems of the male reproductive system, and these structural problems can affect both the production, transport of the sperm, even of this um, line, then we will find that infertility can arrive. We have what we call hypospadias, whereby the urethra is not situated at a point that it should be situated. That position, it can be on the base of the penis, and this one can interfere with the release of semen. And again, we also have blockage of vas deferens, and this one can also prevent the sperms from reaching the urethra. So even those who are born with defects of penis can also result into this particular problem. We have what we call, again, in delivery of some sperms, a condition. Oh, thank you so much, Manyangatinge TV. Welcome, and do share the link for people to join. Retrograde ejaculation is another major condition that is affecting some percentage of men, and this is a condition whereby when a man is ejaculating, instead of sperms moving towards the urethra, it retrogrades back to the bladder. Thereby, no sperm is released into the vagina, which can travel to the uterus, then fallopian tube for fertilization. And this is a major cause of infertility. Again, we have environmental factors that can affect this particular person who has been diagnosed with infertility, and one of them is exposure to chemicals. There are some chemicals that if you expose yourself into, majorly those who are working in major industries, that is why we are expected to put on protective gears, or even the normal pesticides that we normally use can expose us to infertility. So we be careful, we read labels, we wear gloves and protective mechanisms, protective gears when we are handling pesticides. Another very important reason for infertility, whereby many people normally assume, is smoking of cigarette, smoking of cigar. Cigar is from tobacco. And this is very, very vital and very, very important, in that there is a metal that is normally produced by tobacco plant called cadmium, and this cadmium is normally replacing a certain material which is very, very important in spermatogenesis, that is zinc. When it replaces zinc, now infertility arises. So people who normally smoke tobacco, chronic cigar smokers, it will lead to accumulation of this cadmium into your body, thereby replacing zinc and interfering with spermatogenesis, that is manufacture of sperm. Aman Singh, welcome to this channel, and kindly don't go, stay with us. Now, we have others like alcohol. Also, the research has been done and it has been proved beyond reasonable doubt that those who are addicted to alcohol, some do develop infertility due to alcohol interfering with sperm production and maturation. Another cause, which is very, very important, is damage. There are people who are undergoing or radiotherapy, or if you are accidentally, it might result in interference with the development of sperms, that is spermatogenesis in the testes. Now, frequent exposure to hot water or hot bathtub, and some people sometimes call them sauna, but I just know of hot bathtubs, is also a very, very high risk factor of infertility. Exposing yourself, or those who normally swim in jacuzzi, for example, when it is too hot and you are used to it, you do it daily, it normally interferes with the temperature of the scrotum and eventually interferes with the production of sperm. So we are cautioned that even if you have a nice jacuzzi or you have a hot bathtub, kindly do not heat water to much boiling point, but use the one that cannot expose you to this particular problem. Again, in terms of causes, we have what we call immune infertility. Immune infertility is affecting the spermatozoa itself and interfering with a chromosome, which is responsible for penetration of the ovum. So this immune infertility, we have anti-sperm antibodies, which normally are directed against surface antigens of the sperm and interferes with sperm motility and transport. So if this one occur in you, you cannot be able to know this unless you go to fertility hospital, and several tests will be done in this scenario. Now, to recap this in terms of causes, we've talked about abnormal sperm production, we've talked about problems with delivery of sperms, and we've also talked about exposure to environmental factors that we are continuing discussing. Those who normally like a lot of steroids, those normally use a lot of steroids like anabolic steroids, are at high risk of developing infertility. Another issue that can be rectified by simple talking to a patient is depression. Somebody can be depressed due to very many factors. For example, now is January, people call it hypertension. High blood pressure is also a contributory factor of infertility. You know, mostly those who normally suffer from high blood pressure or even diabetes mellitus, there is interference with the erection, and mostly we find that most of them they develop mostly erectile dysfunction. Now, that is about causes of. I'm happy that we are continuing well. Now, diagnosis of infertility is very, very vital. We would like to say that for make a proper diagnosis of infertility, then we must fulfill the definition of infertility. That 1 year and is fertile, or this male is fertile. That's why we normally like couple counseling, and we make sure that every test is done in each and every couple, and then we leave alone the blame game that a man is blaming a man and a man is blaming a woman. So with history in relation to the topic of fertility, we'll perform a general history about this particular individual from family. If you've stayed for a period of 1 year and you are infertile. Of course, now we'll go directly to semen analysis, or what we call semenomogram or spermogram. Will analyze your sperms so that we normally check of quality and quantity. Now, how will we do this? To masturbation, and before you come to the facility clinic, you may come today and you may request for semen analysis. Sometimes we may tell you, no, we cannot able to do this because there are some factors that you may consider before you take somebody's specimen for examination. We normally tell you to abstain for sexual intercourse at least 2 to 7 days before you come to the clinic or before you come to the hospital. If you did sex 2 days ago, we may not have the normal quantity that we have. So after abstaining for this, you will come to the hospital and we will take sample of the semen. And note that we don't only take one sample, we take 2 different samples, which will be 7 to 30 days interval. So if we take one today, we can take another one after 7 days or another one after 30 days to give us the correct result. And in terms, after taking your specimen during semen analysis, we'll do what we call sperm count. Sperm count is going to help us in some of the definitions that I'm going to share with you. When somebody has PAMLI, that there is no sperms at all. It's ejaculating, yes. Semen is male reproductive system, but there is no semen. That is called oligospermia. That we normally check in sperm count. Then we have aspermia. That is lack of semen. You are trying to masturbate, but semen is not there. That is also another cause of infertility. We have azoospermia, absence of sperm cells in the semen. Yes, and then we have pterostospermia, increased sperms with abnormal morphology. That is, the shape and the size is not the normal shape of the sperms. And then asthenospermia, reduced sperm motility. And then we have necrospermia, that one now sperms are dead. Then leucospermia, from the word leukocytes, that is white blood cells in the sperms. So those are the things that we normally look during sperm count. So the sperm count also we checked about, in semen analysis, we checked about motility. Are your sperms good swimmers? You know, when I discussed about how long do sperm stay in a female, I talked about the strength and the energy that the sperm should have to swim directly from the vagina to the fallopian tube for fertilization. And I said it is a journey, and most of them die due to factors that I mentioned in that video. If you have not watched that video, kindly do watch it. We also talked about volume of the sperm. Tens of thousands and millions of thousands per ejaculation, but if yours is less than 100,000 sperms at single ejaculation, then likely you may develop infertility. Then we talk about the color of sperm, which should be white gray and normally decreases with age. Welcome, Wakazi. We are doing diagnosis in terms of laboratory investigation, and we are talking about semen analysis. whereby during semen analysis, we are talking about the color of your sperms as a man. So you should be having white gray color, but when you are decreasing with age, it has a yellowish tint. And in that scenario, when there's a situation that when uh, the color is reduced or the color is extra gray, then there is some conditions that we may think, particularly infection like gonorrhea, normally interferes with the color of the sperms. Now, we also talked about the pH of sperms. I talked about vagina in my previous video, kindly watch it, and now the pH of the sperm, 7.1 to 8. And when there is reduced pH, that is acidic environment, then we might think of blockage of seminal vesicles, and this can interfere with the sperm movement towards the urethra. And when it is too high, that is, the pH is high, that is basic, then we suspect infection, that is maybe gonorrhea, chlamydia, etc. Now, we also check the fructose levels, the fructose level, which should be around 13. Now, that is all about looking at the semen. So we talked about sperm count, we talked about motility of the sperm, we talked about volume of sperm, color of the sperm, pH of the sperm, and then the fructose levels. Those now are left for laboratory technologies to do and give us for interpretation. Then, of course, we will check our blood samples. Blood samples, we are interested in testosterone levels, also the hormones like follicular stimulating hormones and luteinizing hormones. When you have reduced testosterone levels, then you are likely to develop infertility. In fact, it is because of testosterone that give us men age and strength and help to build these muscles. That's because of testosterone. When there is reduced testosterone levels, then actually you find that those normally having reduced levels of testosterone, they are likely to develop infertility. Now, we also perform ultrasound or scanning in normal layman, scanning of the scrotum or the testes to verify whether there is a problem in the testes, where there is testicular lesions or where there is varicoses or even blockage in the path or where the semen normally follow the vas deferens until to urethra. Management in terms of treatment of this particular condition is normally case by case, and this will be done according to how a patient is presenting. And I would like to say that when we are managing infertility, it's better if we manage this when couples are there. You cannot discuss about infertility when you are single, only if you have a problem or cases of Klinefelter syndrome or cystic fibrosis when you have been diagnosed. But if you are married, and mostly these cases normally occur when couples come, we'll normally do it case by case. We will examine the female, give our impression, and also examine the man and give our impression. This is because of the history that I was talking about. For example, before even we think of treatment per se, we will ask the man, have you ever sired a child somewhere before that you are sure of? Because if you watch my video in infertility, causes of infertility in females, I talked about there's primary infertility, and secondary infertility. And in primary infertility, I talked about that these are couples that have never had any child before. There is no issue. They have practiced sex regularly, period of 1 year, 3 to 4 times in a week, bam, there is no child. But in secondary infertility, along the line, they have maybe 1 or 2 children, but they have stayed for some, maybe 2, 3 years, there is no child. And this woman is not using any form of contraceptive, and there is no child. So that's why I'm saying that we ask questions case by case. So if we've known a particular problem affecting particular man or a woman, in this scenario we are talking about men, then we will manage this case by case. Yes, Makojias, karibu sana, welcome. We were discussing infertility, we've discussed about causes, we've discussed about laboratory investigations, and now we are talking about management of infertility. And management of infertility should not be like you are rushing with it. It's something that goes slowly because it is full of psychological torture. Particularly, there are some tribes, or in general, there are some people that if you live with a woman for quite some times and there's no issue, there's no child, then it brings a lot of problems. Now, case by case management, I mean that, for example, if you have varicose, enlarged veins, that one you will need surgery. If you have blockage of vas deferens, automatically you will need surgery. If you have infections caused by chlamydia, gonorrhea, syphilis, you will need to be treated. And in terms of infection, there is no much that it can change, particularly that normally comes late. Because gonorrhea, syphilis can even cause scarring tissues along the line of vas deferens, even can interfere with seminal vesicles, can interfere with the muscles of the penis at advanced stage, the bulbospongious muscles. Now, and again, when you have erectile dysfunction, we'll also treat it case by case. You may develop erectile dysfunction. Perhaps you've been having problems in your marriage for quite a long time. And because of this psychological issue that you are undergoing, you are not able to sire any child. So we will talk to you and maybe give you drugs and stress leading you to premature counseling and the necessary medicine, even before we think of now managing infertility per se in terms of drugs. Now, if an individual presents with maybe low testosterone levels, there are injectables and pills that we normally give, drugs that we normally give, pills, that is tablets or injections. Now, there are medicines that we normally give in terms of injection, and they just contain the hormones that are responsible for the process of spermatogenesis, and we have the follicular stimulating hormone and luteinizing hormones injections, and also we have what we call HCG injections, human chorionic gonadotrophin hormone injection, that we normally give, and these ones are done in fertility hospital. Welcome, the person who has joined, and we are discussing about management of infertility in men, and we are in injections that we have said that we have follicular stimulating hormone and luteinizing hormone injectables, and then human chorionic gonadotrophin hormone HCG injections that is also being given. And we have also the drug that I talked about in my previous video, the clomiphene, that also given to females to help stimulate the follicular stimulating hormones and luteinizing hormone by sensitizing pituitary gland to produce those hormones. Clomiphene also in this scenario act like that. Anastrozole is also another pill that you take. Anastrozole is another pill that you take, and this one is also helping men with low libido, and also elevating testosterone levels, and by doing this we will have high sperm production. Now, in the last but not least part, we have ART. ART is not antiretroviral therapy. This is assisted reproductive technology. Assisted reproductive technology is normally helping. And my previous video, very, very important here. We have extraction of sperms. We extract sperms from your titties. And also lastly, intercytoplasmic sperm injection. So these are majorly done in fertility clinic, and when we have confirmed that even there is no blockage, there is no problem with this particular female in particular male in terms of movement of sperm. So we offer this in terms of injection, and this normally happens into fertility clinic where we refer this particular individuals. So that is all about the discussion of today. I think if you have any question I may take before we close the discussion. It's a type of discussion that has been so nice, and I would like you people now to post any question before we end the discussion. I'm very happy that we have discussed well, and I'm not seeing any question that is popping in. It means that people are very happy with the discussion. If you have not subscribed to this channel, I'm requesting you to subscribe, like, share, and comment. And I'm also grateful for those people who joined me in this particular discussion. I can see Lelem Resh, Akot TV, Aksha Puri, Bomwakazis, Makgojias, Lasik Gendi TV. Thank you so much for this particular support, and may God bless you so much. I'm planning to have another live in 2 days' time, and I hope you will also support me. Otherwise, thanks so much, and may God bless you as I end this live stream. Thank you so much. Let me end it.